Hello viewers, good to have you again. It's another day with your fertility specialist. I'm one of your hosts, Ruth Ogogo, and I have with me today Dr. Kenneth Eguda and Dr. Debbie Olubi. They are both fertility specialists and they'll be giving us a lot of insight into what the IVF process is about. Yes, we know we've heard so much about IVF process, and then it's good that we understand what this whole process is about so that you're able to navigate your way through the process and you don't get confused and okay, what stage is next and all of that. Yes. So I'm leaving it to you guys this morning. What does this IVF process entail? What does it entail? What is it all about? Yes, for someone watching for the first time and they don't know how to go about it. So what do you think about the process?
So maybe I'll start by saying what IVF is for those that the term is new. So IVF means in vitro fertilization. So it's just a process to fertilize an egg with sperm outside a woman's body. This is usually done in a specialized lab, and then the embryo that is generated, which is the precursor of what becomes a baby, is now transferred back into the lining of the womb of the woman. So it's a process, like you said, it's not a one-day thing. Usually an IVF treatment process can last anything between 2 to 4 weeks. It depends on the kind of protocols we're using, because it's not just one size fits all. They're different depending on the client's specific needs and issues that we discover during the evaluation and so on. We use different treatment protocols to achieve our aim of achieving a pregnancy. So IVF treatment process involves a lot of stages. I don't want to be too technical, but I'll say the terminologies and just try to explain. First of all, we need to take over a woman's body. We want to be the ones in control of our ovaries produce eggs. So we do what we call down regulation. This is achieved with various drugs. It simply means we're taking over this woman's body. We're shutting down the natural process so that we can be the ones in charge. After this process, she's usually placed on some drugs that helps to stimulate the ovaries to produce more than one egg. That's our aim in IVF, to get multiple eggs. In a natural ovarian cycle, the ultimate aim is to get one matured egg, but we want to get more than one egg. So we place her on drugs to achieve this purpose. And then after this, we take her to the theater to retrieve these eggs. Her husband's sperm is also collected at the same time, which is used to treat or fertilize the eggs. Then the embryos generated are cultured in the lab for a few days before we go back to the theater to transfer it back into the lining of the womb. So you can see that I've gone through a lot of terms and a lot of process. So it can't be one day. It takes some time. So it takes about 2 to 4 weeks, depending on the method or the way we're going about achieving this.
I like the fact that you mentioned that it cannot be one day, you know, because we're operating in this environment where people are not very exposed to scientific innovations or interventions. And so a good number of time they put a call across to the call center and they ask, hey, we've been referred to you for an IVF treatment. We want to come early today so that we can finish everything and go back in the evening. You know, and so you now begin to wonder, which planet is this person coming from? You know, because now the impression is that you're coming to do it all in one day. You know, so, and I remember scanning a good number of ladies, and while scanning them, just a pre-IVF evaluation, and they ask, are you seeing enough eggs? You know, and then their partner may also ask, I hope you can do all of these things so that we can go back today. And then, you know, you have a lot of explanation to do. So it's just not a one-day thing, you know. And some of them don't also understand that they go through all the process, actually getting the eggs, fertilizing the eggs, incubating the eggs, the fertilized eggs, and then eventually transferring them. I remember a man once asked me, you know, in pidgin English, he said, doctor, she wanna get the big bottle for our hospital, where when we do this baby, we go just put them inside. Then after 9 months,
I'll
we'll go carry the baby, we'll come go home
Because
with her.
IVF babies are called two
Test
babies.
tube babies. You understand? So they really don't understand. And so you may spend time doing a lot more explanation in Africa, in sub-Saharan Africa, especially among the clients who do not understand some of these scientific maneuverings that have to be done. So it could just be a little bit
Okay, so
more difficult. Yeah.
clients, I think one thing they do is compare their treatments a lot. You see some of them that would come and ask that, okay, they've told me that it's 2 weeks. I know my friend, she did her own for 2 weeks, and you're telling me 3 weeks, 1 month. Some even say, I've been on this drug for so long. Why? So are there variation to individuals when it comes to their IVF timeline of treatments, and at their time variation? Okay, are there specific people that you say, okay, yes, or should, for social reasons, can people just say, okay, I have so timeline, I want to come in for an IVF treatment? Is it possible for it to work within 2 or 3 weeks, or are there some that you say, okay, this treatment will be best for you to do this treatment? Let's say the conventional long protocol, if you are going to go that lane. For some people, are there some people that you'd want to go that route?
Yes. So the timeline for each individual will depend on what you're doing for the client, the kind of treatment. We have different kinds of IVF treatment. Some are using their own eggs, some are using donor eggs. So some type of treatment gives you more leverage with time. Yeah, there's some that you need the client to be on ground in the facility for longer. Yes, even for our clients coming from outside the country, we try to make the process as seamless and stressless as possible. So we might start some pre-treatments in their place of domicile, so that they might not be on ground for the total duration of treatment. A lot of factors will determine how long the treatment is. The kind of protocol we are using, that will determine. We have short, we have long protocols. Yes, what exactly we're doing for the clients will determine. Are they using their own eggs or donor eggs? So all those factors and variables have to be put into place to now determine how long this treatment will last for.
Yeah, I think she's summarized it. So if you're doing a short protocol, a kind of short protocol we call antagonist protocol, it could just last like 2 weeks.
Okay.
Yes. So, or at most 3 weeks, from beginning of medication to embryo transfer, 2 to 3 weeks. If you're doing a natural cycle IVF, for instance, where no medications are used, it may just be 2 weeks. Then if you're doing the long, conventional, standard protocol of IVF, it could last as long as 4 to 5 weeks, because now you're starting the treatment at different times of the woman's menstrual cycle. And so a woman wouldn't just compare her treatment cycle with the other woman's cycle, because one, they may be at different age, and these days the kind of IVF being done is individualized IVF. You do the IVF based on the human you're dealing with, the person you're dealing with, her body system. Okay, so the kind of protocol that may be useful for me may not be the kind of protocol that may be useful to you. And so the doctor triages and differentiates the kind of IVF based on your individuality. And so the duration will also differ, based on the individuality, the kind of IVF, and your body responses to medication. You have some people whose body responds just very rapidly to medication. Then while you have others that your body is so slow, they are slow responders, low responder. It may even take a longer duration, even if they're doing the same kind of IVF. And then you could just be in the same treatment cycle with all kinds of women, and then even be doing the same protocol, and she's taking a different medication, and you are taking a different medication. All is it's dictated by your body type and the kind of responses, and whether or not you've had some IVF done previously and you didn't do well with some medication, and the doctor decides to change the medication. So it's just different. But the bottom line is, you get egg, you get sperms, get them fertilized, and after a few days, you transfer the fertilized egg into the woman's body. And the time duration varies.
So I think a lot of people have so much fears, especially women, when they are coming in for IVF treatment. They are scared that, okay, so I'm going to be on injection. For instance, the one that you are saying her treatment to be for like 3 to 4 weeks. Is she going to be on injection for like as long as 3 weeks, 4 weeks? And she's wondering, So I'll be on injection. You know, you get some of these questions. Am I going to be on injection? Maybe the IVF nurse just called the clients that, hello, madam, you're starting this injection. And then the next question popping up, am I going to be on this injection for the whole of the 3 weeks I'm doing this IVF treatment? Or am I going to be on the injection for the whole of the 4 weeks? Like you said, the treatment takes. So yes, are they going to be on injection for so long? Because I know this whole IVF process can be very rigorous and stressful, especially for women. So yeah, let's try to allay someone's fear. For those that think that it's all injection round the clock.
No,
So are they usually on injection round the clock till embryo transfer?
No, it's not all injections right round the clock. All the medications we use are not all injectables.
Okay.
Some are oral tablets, some are pastries.
Okay.
Yes, so those are part
wow.
of what we do in the preparation phase when we counsel them.
Okay.
We let them know you're going to be on this injection for this duration. We might change to another injection, you'll be on this. So please let their fears be allayed. You're not on injection for the whole duration. There are different forms of medications that are also used.
Okay, so we'll be wrapping up shortly, but just to let you know, for someone watching and that would watch later as well, IVF is individualized, so you don't compare your treatment with someone else. Yes, your friend might be having this, but then you trust your physician, trust your specialist.
Before you round up, please, I have something very important I need to say.
Okay.
You know, women come in, for instance, on the day of embryo transfer, you know, where there are no policies of number of embryos to be transferred. You know, a woman would say, you transfer 2 embryos to this other woman. Why do you want to transfer 1 embryo to me? Or you've done 3 embryo transfers here. Why do you want to do 1 embryos for me? You know, a lot is considered when embryo transfers are going to be done, okay? The first thing is the policy, the law of the land. There are situations or some countries or some regions where only 1 embryo transfer is permissible. There are some that could tolerate 2 embryo transfers, you know, and then there are some that don't even, they don't care, whatever you want to transfer, just get the woman healthy, you understand? So women shouldn't complain or compare the number of embryo transfer. And then the health of the woman is important. There are some health conditions that you don't want to be reckless transferring more than 1 embryo. So the woman shouldn't get worried when she's having just 1 embryo transfer, because her body may not be able to deal with more than 1 embryo when it implants, okay? So you want to get the woman safe. The first, and that's the first intention is what's safe for the woman. Second intention is what is regionally and constitutionally acceptable by the government. You know, more especially in the countries where governments, the insurance is being, it's the major provider of the health care. You know, so yeah, women shouldn't do all that comparison. And then, of course, even the medication after embryo transfer, women compare theirs. Because I've seen women on the day of embryo transfer, I mean, day of pregnancy test. By the way, I don't like that day, you know, because there's a lot of trauma. Trauma to the doctor, trauma to the patient, and trauma to everyone who is around, okay? And then they tell you that we know why we didn't succeed. It's because you placed this woman on pessaries and you placed me on injectables. So the treatments are not the same. And that's why she succeeded and I didn't succeed. No, ma, or no, sir, that's just not the question. That's not the reason. You know, you didn't succeed for reasons that are peculiar to you and the embryos, and not because of the kind of medications, that she is consuming. So a whole lot of differences. So one person's IVF treatment may be a whole world of different compared to the next person kind of IVF treatment.
So it all boils down to saying that everybody has that peculiar treatment. So never compare your treatment with someone else's. Yes, whatever medication, just trust your fertility specialist to navigate you through the right path and hope that you achieve success with this idea. Yes, as we wrap up, yes, Dr. Ken has given us his own share. Just give us a wrap up of what you think of the IVF process in general for someone watching and is set for the IVF process. Yes, what's your counsel to that person?
We're here to make the IVF process as stressless and as possible for you. There's nothing to be afraid of. Where you can ask questions if you are, need clarifications about anything. Just be open and free with your fertility specialist. Our aim is to help you achieve your baby dreams. Thank you.
I still have something. Don't wrap up, please.
Okay.
I'm sorry. I have a lot of experience about these things, so I keep remembering, and I feel that the public should know about it.
Yes.
The most complicated IVF treatment I have seen with respect to timing, planning, and organization is the IVF with the pre-implantation genetic diagnosis.
That's
true.
You understand?
That's
Why we
technical.
mentioned that IVF could last 2 to 4 weeks. IVF with pre-implantation genetic diagnosis in Africa, for instance, could last more than 3 months.
Wow.
It could last more than 3 months, because one, depending on the peculiarity of the woman.
Yes.
Most times we see a lot of women coming for this modality of treatment coming in at very advanced age. Where they may not be able to produce good number of eggs at a go. And then you need good number of good embryos at blastocyst. Because when they are subjected to pre-implantation genetic diagnosis, a good number of them may be screened off based on the condition you want to screen for. Call it the sickle cell character or trait or disease, or the sex-linked trait or sex itself, I mean the gender of the baby. So you could have 10 embryos, for instance, and you screen all of them and they're all females when the guy wants males. Or you have all of them having sickle cell when you want sickle cell-free babies. During this period, embryos are generated, they may be frozen while the woman is without any medication. And then when you achieved your diagnosed embryos, you further prepare the woman, Some women may go through stimulation for 2, 3 to 4 times.
Wow.
If they don't produce adequate number of eggs of good qualities. So it could actually go very weird for some
That's
people.
another twist to it.
It's another twist, a very complicated twist.
Yes.
And if you don't understand, you feel that someone is playing with you,
Exactly.
and all of that. But of course, it can also be seamless. In countries where they do diagnosis as you just do get your embryos, you could have it within the same 2 to 4 weeks. But in some countries where the genetic laboratories are not available, you could have the embryos frozen and wait until you get the diagnosis before embryo transfer is done. So I think I can permit you to end the show at this point.
So it is good to let you know that even this PGD that Dr. Kenneth talked about is also being done in the Alps Hospital, and every form of IVF treatment you want to do is also done in the Alps Hospital and Diagnosis. As a matter of fact, Alps Hospital is your first choice for any fertility treatment that you want to think about. So I hope to see you, just in case you're watching and you need an IVF treatment. I hope to see you soon. Bye.